Hi, Shana.
Hi.
I am here today with a patient, Shana, who came from Las Vegas to visit Maze last month to have our unique Botox procedure with vaginal dilation for vaginismus. And I want to say thank you so much to Shana for coming on this platform with me to talk about something that is not easy to talk about. Vaginismus is a condition that a lot of women suffer with in silence, and it is probably more common than we think. And I think we need more women who are willing to share their story and tell us about their experience. So, Shana, why don't you first tell us a little bit about your history and what brought you to sort of realize that you had vaginismus, think you have vaginismus, and then eventually lead you to see us here in New York at Mays Women's Health.
Yeah, thank you for having me on and talking with me about my story. I know that so many women are feeling alone in the vaginism and having vaginismus. And I just didn't want another woman to feel the way I did when I first found out about it. So
Mm-hmm.
that's why I'm here today using my voice. First off, the way that I found out that I had vaginismus is by attempting to have sex, quite frankly. I described the sensation as hitting a wall, like it just was basically
Mm-hmm.
impossible and it didn't feel like something that I even wanted to do just because I knew internally that it wasn't supposed to go the way it was going. And so
Right.
I was not even able to have a penis inside of me essentially because there was some sort of blockage there that just wouldn't allow it to fully enter my body. And I
Mm-hmm.
knew that I needed to go see a doctor, but I had no idea that there was a term for this. All I could speak on was the fact that I experienced a little bit of anxiety and fear when it came to penetration, in the sense that I described it as bracing myself. So when I would
Mm-hmm.
attempt to have sex, I would kind of react visibly and physically with this resistance. When you know
Mm-hmm.
that something painful is about to happen to you, you react, right? And that's what
Right.
was happening to me, is I was
Absolutely.
associating penetration with pain. And so I couldn't really fully relax or breathe into the experience. And
Mm-hmm.
I also felt the hitting a wall sensation. So it kind of
Right.
made me very closed off to having sex overall. And
Mm-hmm.
I had to bring my concerns forward to my mom and my sister because I I needed to find a solution and
Mm-hmm.
and I knew that both my mom and sister were very safe people that I could talk to about anything. So I quite frankly just told them something is wrong. I'm not able to have sex. And at the time I had a boyfriend, so it was very much a priority that I would be able to have sex with him because I loved him.
Mm-hmm.
So when I shared that information with my mom and sister about my symptoms and what I was experiencing when I was trying to have sex, my sister actually found information online about vaginismus. I don't know exactly what she searched to pull that up,
Mm-hmm.
but she sent me screenshots of different posts that she had found on Instagram, and everything that I had read about really perfectly described what I was going through for my specific case.
Mm-hmm.
Because I know that some women, they experience a lot of pain or an inability or just a lot of
Mm-hmm.
discomfort. In my case, it was mostly just an inability.
Mm-hmm.
And
Right.
so the more I read about it, the more I resonated with vaginismus, and I knew that it was definitely what I had.
Mm-hmm.
I hadn't even gone to a doctor when I found out about this. I was just doing a lot of my own research to figure out, like, what is this even caused by?
Mm-hmm.
Um, And the only thing I could actually trace it back to was that I did have a pretty traumatic pap smear done about a year prior to having this Botox procedure by a doctor that I was completely unfamiliar with. It was inside of a Target, and it was a clinic that my insurance recommended me to. And what
Mhm.
happened was, I went to go get a pap smear done because I was told that when you hit a certain age, everyone just has to go do it. I wasn't even sexually active at the time at
Mhm.
all. I hadn't even ever had anything inside of me except for a tampon, which I never
Mhm.
had any trouble with. So I walked in to get this pap smear, and the doctor was a very lovely lady, warm energy, kind, nice. And I told her, hey, I have never had sex before. And I was very visibly anxious. My face was beet red. I was crying before I even had the exam done.
Mhm.
I could barely open my legs. So
Mhm.
I already had a lot of anxiety before I had ever even had sex for the first time.
Right.
I'm
Right.
really somebody that gets very afraid of needles and having blood drawn and really
Right.
anything medical. It's not my
Mhm.
jam. So
Mhm.
when I had this visible anxiety, the doctor, for whatever reason, I guess didn't really take that into consideration and just proceeded with the exam. And it was just very traumatic because I really didn't want to have it done. And I was terrified that I would be in a lot of pain because all my female friends told me going into the pap smear, it's going to hurt a lot. So, of course, I walk
Mhm.
in there with a lot of anxiety.
Mhm.
And so I had it done, and I'll never forget just hysterically sobbing even after the pap smear on the phone with my mom. And the memory really stuck with me so much that even a year later, when I would talk about it with like my doctor or
Mhm.
anyone for that matter, it would always bring tears to my eyes. Now I
Mhm.
feel a little better about it,
Yeah.
but I just knew that it was traumatic because it evoked such a response from me emotionally. And that's the only thing that I can attribute to me having vaginismus.
Mhm.
Anyway, yeah, go ahead.
Yeah, no, I mean, I think that even prior to the actual exam, those symptoms, those feelings that you were having, the anxiety feeling, that sort of heart racing, that barely being able to open your legs, like though that is part of vaginismus, right? Even so the exam didn't help. It probably just compounded what was already going on, and that is what we see a lot, is that women who have vaginismus, there is this underlying fear and phobia of penetration for some reason. It's almost an involuntary response that even though you feel like you should be able to relax, you can't relax. And then if you add pain on top of that with the penetration, it only just makes that fear and phobia worse. And then it grows. And then you avoid more penetration or avoid the exams, or it's harder to get help because you're afraid of it, right? Um,
Yeah.
so that's pretty classic, is that my patients who have vaginismus will say, I tried to do that GYN exam, but I couldn't get through it, right? I couldn't open my legs, or I was so afraid I just left the office. And there are many providers who surprisingly don't recognize those symptoms and don't take the extra step to say, well, this could be a sign of vaginismus. Let's not just sort of force a pelvic exam on somebody. Let's try to figure out why you're having that reaction and treat that first, right?
Yeah. And
Because
actually, when
post procedure, you could probably do an exam very differently than before.
yeah, and the only thing that that doctor had said to me when we were done with the pap smear was make sure you use lots of lube when you have sex for the first time.
Right.
So I get she was being helpful, but having that experience, now that I look back at it, I realize the importance of finding the right doctor that really knows your history
Mhm.
and is very well educated in women's sexual health the way that you are and the people at your
Mhm.
clinic are. because, like you said, it would have been great if she had seen the very obvious signs of anxiety and my unwillingness to open my legs and thought, hey, somebody with this much anxiety and fear of,
Right.
medical stuff might be like somebody that has vaginismus. So
Right.
anyway, that was a big mistake, was going to a random doctor that my insurance recommended and not somebody that I knew really understood me and my life experiences. But it led me to where I am today. And I believe that, like, things happen in my life so that I can basically help other people who are going
Mhm.
through the same experiences that I
Mhm.
have. So I'm not, going to look back with a lot of regret, but I do recognize that that's been a really essential piece of what has happened thus far
Mhm.
with my vaginismus story. Anyway, so once I realized what vaginismus was, honestly, I was very disempowered. I immediately thought, oh my God, like something is wrong with me. And I have a boyfriend that's going to leave me because I can't have sex. And I will never be able to be in a relationship again, because who would want to be with me when I'm incapable of having sex, which is such a essential part of being in a relationship. So I
Mhm.
actually went down a really dark path of just negative thoughts. Um, and also for me, it was a really devastating thing to hear just because I had just gotten into my very first relationship ever. So here I am, like the happiest I've been in a long time. And I'm so hopeful about what's to come. And I have this person that I love so dearly that loves me to death.
Mhm.
And yet I can't create this experience with him that is going to enhance our relationship. I'm like incapable basically because of this medical condition that I now know I have. So I like luckily had my mom as a support system and my sister too. And I told them like I was so devastated, and they kind of gave me a pep talk and said, Shana, if you were to be in front of any other woman right now that had vaginismus, what would you tell them? Would you basically tell them that this is a life sentence and they're never going to be in a relationship again and they're doomed basically? Or would you say, hey, you know what, let's see like what
Chances.
the
Right.
possibilities are to get help, and see how this is something that you can overcome. And God, am I so thankful that my mom really, you know inspired me in that moment, because she saw that I was being my own worst enemy instead of my biggest cheerleader. And that's really when I turned things around and I thought, okay, I need to figure out how I can get help for vaginismus. And I started researching on WebMD. It said, use vaginal dilators, go to a pelvic floor therapist. There was no mention of any Botox procedure or anesthesia at all. And honestly, when I read about the treatments on WebMD for vaginismus, it still didn't empower me. I'm like, oh, dilators, like that seems like such a slow process. And the thought of even inserting anything into my vagina just didn't intrigue me at all, because I only associated that with impossibility basically. So
Right.
why would I go test out dilators when I already know that I can't get something inside me other than a tampon? So
Right.
everything I read just was disheartening, disempowering, until one day I decided to go on TikTok, and I thought, let me go hear from actual women who have this, because I had never even heard of vaginismus, nor did I know anyone that had it when I told them about it. And
Right.
so I started watching videos of random women that had vaginismus. And some people were talking about how they hadn't even gotten help for years and years and they were still living with the condition. And I was like, oh my God, I might have this for years. Like everything I saw was just, it was getting worse and worse and
Mhm.
worse for my mindset in
Yeah.
having to deal with this. So it wasn't until I found a video of Mays Women's Health Clinic, and it was a couple doctors talking about how they use Botox under anesthesia to
Mhm.
help cure vaginismus for women. When I saw that, I immediately was like, oh my God, this makes sense. They use Botox to relax the muscles, and I
Mhm.
don't have to be awake for this. So I'm not going to be fighting back. I'm like, sign me up, you know? It just seemed like a very fast way to get results and
Mhm.
in a way that was pain free. And for me,
Mhm.
that was my biggest concern. I did not want to get re traumatized from having a procedure done like in having a procedure done that was very intricate and complex. I did
Right.
not want to be um, scared. I didn't want to have anxiety going into that because I can't even get my blood drawn without crying. So it just like it really eased my mind to know that I could be put under anesthesia and have such great results that were shown from your
Mhm.
website. So as soon as
Mhm.
I saw the TikTok from Maze, I immediately looked up Maze Women's Health Clinic on Google, went on your website, and what really blew me away was the amount of resources that were available there. I had not seen that anywhere else. There was so much like videos and links to other resources and even a discussion forum of other women that had vaginismus. I just couldn't believe it because for the first time, after seeing all the resources you had on your site, I was like, oh my God, there are actually a lot of other women that are going through this and they're getting help. Like, I just, it felt like a big breath, a big sigh that I could finally take where I realized there's an alternative way to treat my vaginismus without having to go through a long, strenuous process of dilation with a pelvic floor therapist.
Right, right, right. And I do think that is this unique approach to this procedure is that it does speed things along. And I have plenty of patients I see here at Maze where we do traditional vaginal dilation, and we start at the smallest size and we work our way through step by step, and that works too. But for some patients, one, they some of them really struggle with even getting that first dilator in. So the Botox procedure is so helpful in kind of giving women this jump start to that process. And there is, with many vaginismus patients, this sort of this mind body disconnect that the procedure really helps to connect, right? So with this procedure, you are put to sleep. And while you are asleep, we make sure we do a full exam. And in your case, Shana, we did have to cut the hymenal ring a little because the hymen was completely intact. I think that makes a big difference for a lot of women to make the vaginal entrance wider and more open. And then when we put those dilators in, we ensure that we can insert a large dilator that's the size of a penis. And you wake up from the procedure with that inside of you, with the vagina all numb. And so it's very empowering to wake up from anesthesia without pain, with this dilator inside of you, and you are then guided and encouraged to move that dilator in and out, take it in and out. And that really helps to connect sort of your brain and your body to empower you to know that my vagina is normal. This is possible. I can have penetration. I can have penetration with something that's as big as a penis. And it really does help jumpstart the process. Now, as you know, you still need to dilate regularly on a daily basis. And, after the procedure, you do kind of backtrack a little bit and go to some smaller sizes and work your way back up. But it does give you that jump start where it creates the environment that is empowering and that you can do it.
100%. Yeah, I'm glad you mentioned all that. When I discovered Maze, Obviously, there was no question in my mind that I was going to go to your clinic, especially because I saw that it was a women's sexual health clinic. I looked around for this Botox treatment for vaginismus, and it kept bringing me to, male plastic surgeons in like random states. And there was something that was way more comforting about being around feminine energy in a time like this that made me all the more convinced that I should fly from Las Vegas to New York to have the treatment done by Mays instead of
Mhm.
anywhere else.
Mhm.
And so I think that was a huge part of my decision and how I handled this. And I want to mention that before I even went to Mays, I actually did go to pelvic floor therapy. I only had 3 appointments, and it was really hard. It was still hard because of what you're saying. There was this mental barrier that I kept experiencing of the anxiety, especially of having somebody else
Mhm.
insert something into me, which is what you do in pelvic floor therapy. That was really difficult. And I don't want to say that it wasn't helpful to go to pelvic floor therapy, but I think what the Botox treatment at Mays gave me was a way faster method of getting there. And now,
Right.
like you said, I literally have experienced the complete 360 difference from before my treatment at Mays to
Mhm.
after. And
Mhm.
what was most shocking about all this is that you had discovered in the Botox anesthesia procedure that the reason I was literally unable to have sex was because of my hymen being too thick. I would have never even known that. And it makes total sense why I had described having sex as hitting a wall, because there literally
Mhm.
was a wall and it was my
Mhm.
hymen. And so
Right.
I can't imagine having to break my hymen without being under anesthesia, knowing that mine was thicker than the
Thicker,
usual.
right, right. And I do think that we do see a number of women with that issue. And if you combine that with this underlying layer of anxiety, fear, phobia, that combination, makes penetration pretty much impossible. And so, we ensure through this process that, the entrance is free of barrier, that something as large as a penis can get inside, and then continue to give you support, which I think is very unique about our practice here at Mays, is that, you are followed by a clinician, me, and also a therapist, my partner, Helen, who, we will follow you post procedure. We meet with you sort of every week to kind of check in, see how dilation is going. And in your case, we've even dilated virtually together over our telemed platform to kind of continue to give you support. And I really think that's also unique to our practice too, is that you're not going to fly in and get a procedure done and we're going to say, okay, see you later. No, we are checking in every week. We are in communication through the portal. We are giving tips and techniques. And that, I think, is also why our patients continue to, progress.
For sure. That's a great point that you bring up, is just the level of support that Maze has given me has been unparalleled. I mean, it just felt really like warm and fuzzy to come out of the procedure knowing that when I got home back to Las Vegas that I would still have you and Helen the therapist as a resource as I continued the dilation practice. And I also want to talk about like how it felt for me coming out of the procedure when I woke up, kind of groggy from the anesthesia, and I realized that I had the largest size dilator in me. It was just, I was in a state of disbelief essentially, because here I was just a month before, not having anything be able to go up there besides a tampon, to having the largest thing go up there. And so I was just very happy, of course, and grateful that this procedure exists and that this clinic exists specifically for women. And then just like being able to have you on a hotline in a way for whatever questions I've had along the way has made this even more of a wonderful experience. So thank you so much. And also, since the procedure has been done, I've been dilating just about every night with the gradual progression of the dilator sizes. And I have literally, as I speak today, been able to insert the biggest size dilator on my own without anesthesia,
That's
whereas
amazing.
I could not even do that before. There was just no chance.
Yeah.
So that is some major progress right there.
Right. And you
And
are, what, 3 weeks, 2 days from the
mhm,
procedure? That's amazing progress.
yeah,
Um, yeah, and I would say that, that's a little faster than sort of our average. But usually for the majority of our women, they are putting in that largest size dilator at like the 4 to 6 week mark post procedure, which is pretty amazing since most of our patients who come in to see us couldn't even put a tampon in. I mean, that is typical that we see women who have never been able to penetrate with anything. And then within 4 to 6 weeks can be inserting the largest dilator. So it really is a procedure that helps to, fix sort of the physical piece, help to fix the physical piece by relaxing those muscles with the Botox, by ensuring the hymen is not intact and the entrance is open, and then helping psychologically that mind body component, empowering you to dilate, and then continuing to give support over that next month post procedure as your cheerleader, as your guide. Encouraging you to continue doing those daily dilations, which, is an exercise, right? It's something that you really do have to be committed to doing, but we're there, we're continuing to check in. And I really think that is what makes us very different from other practices out there.
Totally. And it's been like really amazing just to see the progress that I've been able to make completely on my own. And I've noticed that the fear and anxiety has definitely gone away only because now I don't have this belief that it's
Yeah,
impossible because I'm
right,
experientially
right,
seeing the opposite. I'm
right,
seeing with my own two eyes that it is possible. So coming
right,
from that belief that it is possible completely changes the way that I feel inside and the way that my body reacts because I know that your mind is very powerful when it
right,
comes to your body, right? Like, so being
absolutely.
able to have that like clarity and sureness that I can do this has been really instrumental in allowing my body to open up to even just the dilation. And I wouldn't have that without the Botox because the Botox is what broke the barrier that I
Right,
actually needed to have
right,
broken so that it
right,
could be possible.
right.
I
Exactly.
know not all women may have had the same situation that I had in the sense that, their hymen may be different than mine,
Mhm.
but there's definitely something to be said about the way the Botox works and relaxes your muscles that creates an experience that was once impossible that then rewires your frame of mind,
Right,
which then affects your body's response to
right.
penetration.
Absolutely. And even without, a high, thick, or intact hymen, some women experience that wall feeling just from the muscles being so tense. That for some women, their vaginismus is so severe that those muscles are so tight and tense that the penis feels like a wall because they're so stiff and you can't really push through them. So the Botox activating those muscles to be unable to clench and tense up, it makes dilation possible. You still need to dilate. And that's something that I always discuss with my patients too, is that in my experience, Botox alone is not enough. You need to do the Botox to prime the environment for the dilation or the physical therapy to work, right? The Botox is a piece to that puzzle. So I think that your experience is such a success, and I'm so happy that you are here talking to us about it and you agreed to talk to us. Is there anything that you discovered that we haven't talked about that you want to bring up?
I think the major thing that I want to relay to any woman listening right now is really to focus on your mindset about vaginismus, because that was where I experienced the most pain, was actually the thoughts that I was having. It
Mm-hmm.
wasn't even the inability to have sex. The biggest pain was the fact that I literally became my biggest enemy in the time that I realized that I had this condition. And that is the most damaging thing that you can
Right,
do, in my opinion, because I mean, a negative thought loop like that can really make you go down a dark hole, which is
yeah,
exactly why I had thought, oh my God, I'm never going to be able to be with
right,
anyone ever again. Like, people
right,
are going to leave me. They're not going to love me as much. I'm something is just inherently flawed about me, and it's not even fixable or figure outable. So for anybody that's listening or watching this that has vaginismus, I just want to tell you first that I get it. And it's so easy to go down that dark road with yourself. But the first step is really being able to acknowledge that there is support and resources available to you. And you can make significant progress. You may have to be patient with it, and that can be tough. But
mhm,
the best thing you can do for yourself is to really believe in the possibilities that are available to you.
yeah.
That is just the number one thing that I want to tell people: believe in the possibilities.
And you're not alone. There's resources out there. There's help out there, and you know, don't be afraid to take that first step. Which I think for a lot of vaginismus patients, because there is such a fear around surrounding it, that really often the first steps are the hardest. Those first initial phone calls, or making that first appointment, either with Maze or with a physical therapist, but it gets easier as you keep going through the process.
Yeah, I think it's really important to open up to people who you know are going to give you a safe space to express what you're going through. I've had so many people who told me that what I was experiencing was in my head, or that all I needed to do was drink wine or smoke weed or breathe or take
Mhm.
a bath. And
Right,
nobody had ill intentions in saying
right,
that to me.
right,
They just didn't know. And so
right,
you might find that a lot when you open up to people, that they just don't even, I had somebody tell me, well, I just believe in biology and all humans are biologically wired to have sex. So it's as simple as that, right? But it's actually not. And I learned
right,
that in this process. It
right,
doesn't just come
right,
down to biology. We are all
right,
so different, physically and internally we are. And I think that, like, it's so important to recognize that whatever you're experiencing is very valid, and don't let anyone tell you
right,
differently. Like,
right,
trust your intuition the way I did when I knew something was not right.
right, right. Yeah, and pain is pain. I think that pain is not in your head. You are feeling it. That is real. I think don't be afraid to find another provider if the first one you go to doesn't give you, answers that make sense to you. Um, And for sure, if you are struggling with vaginismus, call Maze, even if it's just for a 10-minute phone consult to get more information. We do free 10-minute phone consultations. Helen does them all the time. And if you think that you might have vaginismus but you're not sure, give us a call. We'll help guide you.
Yeah, and I even, told Maze that I would be an advocate for this vaginismus Botox treatment because I want women to see that like this is available to them. So I even, put a public post on my Instagram after I had the procedure done just to hopefully reach other women that are struggling. And sure enough, that's exactly what happened. I had, 5 or 6 women reach me and want to hear my story or ask me about my experience with Maze. And so if you're listening and you also want to just talk to someone who really gets it, but can
Right.
also, instill some hope in you at the same time and guide you to Maze, please reach out to me on Instagram. My handle is Shana, Shana .Ginsburg, Ginsburg. And thank you, Melissa. If you have anything else to share,
Great.
go for it. But I am so grateful for you and your team for helping me get to where I am today.
And thank you, Shana, for being so brave, for talking about this openly. And I think this is really going to, start deeper conversations. I think we're going to have, more women reaching out to us because you have put your voice out there. And I'm so proud of how far you've come and how well you've done, and that was all your work, right? I mean, that was, yes, we were there to kind of guide you along, but you did the work, you made the commitment, you're doing the dilation every day, you're working through it. And so I'm so excited I can tell, Helen, that you put the largest size in. That's awesome.
Yeah,
So yeah, that's great. So hopefully I'll be seeing you next week. We have another session set
of
up for next
course.
week, so I'll talk to you then.
Yeah, and thank you for joining me in this mission to kind of reduce the stigma that comes with talking about
Absolutely. I
sexual
have
health.
Absolutely. I mean, I have been seeing women with vaginismus for over 20 years now, and it really is a passion of mine to, to get the word out that this condition is completely treatable, curable. Do not suffer in silence, and don't wait. You know, if you are out there and you are struggling to put a tampon in, you've
Mhm.
tried many, many times and it's not going in, or you've tried to have intercourse and it's not happening, it won't get better with time. Like, it needs to be addressed and treated. So come on in. We're here to help.
Awesome. Thank you so much.
All right.
Okay, cool.